My name is Jeremy Ringewald. I'm a pediatric cardiologist specializing in interventional cardiology for both children and adults with congenital heart disease at St. Joseph's Children's Hospital and St. Joseph's Adult Hospital. There are some patients with congenital problems of their heart that actually into their 50s, 60s, or 70s wind up needing us, particularly to work in a collaborative approach with our adult cardiac surgeons and or adult cardiologists. These days, because of the successes of surgery for congenital heart disease 30, 40, 50 years ago, we now have, patients in their 40s, 50s, 60s, 70s with things like tetralogy of Fallot that, historically had been, a death sentence for many of our patients, and now it's something that we can fix, and you go out and you live your life and you do well. There are certain problems that happen later in life on occasion with those patients, and again, when you're a grown-up who has a congenital heart problem, we wind up being at least a part of the mix of who helps take care of that problem down the road. So a large number of patients in the United States and in the developed world that have congenital heart problems have been getting operations and doing well for many decades. And because of that, actually, as of over 10 years ago, there were, for the most common congenital heart, one of the most common congenital heart problems we have is something called tetralogy of Fallot, which is something that is if a baby is cyanotic or blue right after they're born, is one of the most common, is really the most common diagnosis. Those patients, there's more grown-ups with that diagnosis in the United States than there are children. So because those patients have very specific plumbing issues down the road, they have plumbing issues in terms of their main blood vessels and their main chambers of their heart that are still issues that are associated with their main diagnosis. And so as these patients age, they tend to need a very collaborative approach with us taking care of, us by that meaning the pediatric cardiologist taking care of their abnormal plumbing issues, and then adult cardiologists taking care of their acquired heart disease issues, like if they develop narrowings in their coronary arteries or high blood pressure or all the normal things that happen as patients age. One of the unique things about St. Joe's is because we're a children's hospital inside an adult hospital, it's very easy to make those collaborations happen in a very momentary basis. We can go from treating an abnormal heart rhythm to diagnosing a coronary problem to having an adult interventional cardiologist fixing that coronary problem all in a period of minutes, and because all those players are in the same pool playing together all the time.